This show is for informational purposes only. In view of the complex nature of health and disease, it is only recommended that you change your current treatments or healthcare practice with the direct assistance of a health professional. You can contact Dr. Dale if you desire to achieve true health. Call his office at 931 591 2010.
Welcome, everyone. Again, this is live on Facebook Tuesday evenings. We will be starting a regular program here Tuesday evenings starting at 6 p.m. Wanted to answer some of the questions we have right now on Facebook from our last show. I had an individual ask me about just pillows, wondering what the best pillow would be for the structure of their spine. I suggest using contour pillows, memory foam type pillows. I highly recommend when you're looking at whether it be bed sheets to especially your mattress, your pillows, go with organic materials because you're laying on that stuff 8 hours a night usually, and sometimes more, sometimes less. But organic materials, because of the fire retardants and the chemicals that are in the mattresses, the mainstream mattresses, man, those are so toxic, connected to things like leukemia, breathing disorders, mental fatigue, sleep disturbances, because you're breathing in those chemicals constantly. They're off-gassing throughout the night. So highly recommend organic materials there. In terms of pillow, again, a contour one that's going to support the normal cervical curve if you lay on your back at night. That's the best position if you can. If you're a side sleeper, then a smaller pillow, one that keeps your head roughly, your spine roughly in a straight alignment. Also, one way to actually take care of your spine in a really cheap, effective way. I, in fact, have molds I sell to my patients. I encourage them to use those things, and people watching this, even patients will be watching this. I tell them, if you wanted to, just go out and get yourself a noodle, roughly 3 inches or smaller in diameter. Now, depending on your height, you don't want to go too large with that diameter of that pool noodle, but that foam. What you can do is actually support the normal curvature of the neck, because when you lay on your back, the back of your head should actually contact the mattress if you have a proper cervical curve and the proper curvature in your neck. And using a roll or a foam roll or like a pool noodle, cutting it down just 6-8 inches long, placing that underneath your neck, supporting the normal cervical curve, molding your spine as we call it, can definitely help in taking care and maintaining the proper arc in the neck and the proper health of your spine. So like that little question there, how do I find a chiropractor in my area? I believe Crystal asking this question out of Hollywood is where she was. That's tough. I mean, just my personal take on the structural correction is key. I believe that supportive exercises are key. Physical therapy is amazing for muscle injuries, but the reality is, combining a structural muscle rehabilitation and strengthening regimen with the right alignment, that's key. Don't just strengthen your spine and work on your muscles when you're not correcting your spine, because that ultimately isn't correcting the spinal alignment, isn't restoring proper motion and movement to each individual segment of your spine. Make sure that you're doing that. So proper structural correction chiropractic care will incorporate usually exercises beforehand or modalities, treatments that help loosen the muscles, relax the muscles, bring blood flow circulation into the spine. A lot of times just general range of motion and stretching can be great prior to an adjustment. And then an adjustment that's specific and detailed in terms of structurally correcting the alignment of your spine, not just mobilization. Now, there's times for mobilization, and there's times that you definitely want to be very specific with the structural correction of the spine. Those adjustments, once the bones are in better alignment, then immediately following that, you want to make sure that you're doing strengthening posture, strengthening exercises to stabilize the spine in the proper position in which the chiropractor just placed it. So make sure that you're doing that. That's if you talk to them. I mean, I've got best friends back in Ohio that I tell them, they come down here. I've worked on their spines. I give them the equipment. I give them the exercises, and they go back home and they utilize chiropractors there that at least give specific and beneficial adjustments there, and they do the exercises that I've given them. They do the equipment exercises and things like that, and they'll do some stretching in the office prior to, even though it's not, that's chiropractor's technique or what they do, but they incorporate that, and they seem to get great results still. So Excellent, excellent, excellent. So we're going to be talking today again about really getting the root causes of why so many people are having their organs removed. And it's so sad to see so many people still suffering after they've had their gallbladder removed, see women lose their ability to even have children if they wanted to, especially have more children in their future, but yet they have their ovaries removed or they undergo a hysterectomy because they had inflammation in their reproductive system or pelvic floor disorders. And the research dates back again. This is what's so crazy is the research dates back all the way to 1933, folks. That should, well, if you've had those organs removed, it should actually tick you off. And it does me that we haven't been focusing on that yet. At the end of this, like I said the last time, they literally pleaded with the medical profession. These Stanford University physicians, orthopedic surgeons, orthopedic doctors saying, please, please, we plead with our profession as a medical profession that is supposed to be doing the best by the patients. We need to evaluate the alignment of the spine. And they said before anybody undergoes surgery, they should have their spine evaluated. If you've got gallbladder issues, do not just have that gallbladder removed just because when they poke you in the right upper quadrant of your stomach, they just poke you there and then you're like, ow, and then they say, oh, you must have gallbladder issues, and they go in and remove that gallbladder. When so many people are having a healthy, functioning gallbladder, literally the gallbladder in essence is not in a sense functioning perfectly because you're having pain, you could have problems with it, you could be beginning to develop disease, yet you could actually reverse that disease process in your gallbladder if you get pressure off the nerves in your spine. And I've seen this happen in so many of my own patients. They have curvatures of their spine curves out to the side, and the pressure on the nerves that go to the gallbladder are being impinged, they're being pinched, they're being placed under tension, and that changes the nerve tone. So the tone of the mental impulse, the neurological impulse, that electrical impulse from the brain down the spinal cord out the nerves is now interfered with, and that gallbladder begins to malfunction. And in this research article here, again, dating back Stanford University, 1933, spinal curvatures, visceral disturbances in relation thereto. Talking about irritation of the spinal nerves. I'm reading this direct quote from them, and I'll read several direct quotes, and we'll comment and we'll talk about it a little bit. I am looking here on Facebook, so I do believe I can answer questions on the fly, hopefully. If we have any comments, questions, concerns, you want to hear, you want any type of topic discussed. And again, hopefully when we have time at the end of this, if I get through the main gist of this information, I want to comment on this study right here. This is, it was just amazing to me that right before I decided I wanted to discuss this topic of medical marijuana use, should we or should we not be legalizing marijuana for medicinal purposes? You know what? I'm an advocate for sure. Far less risk when you look at the literature compared to things that are already being prescribed like narcotics, which again have been just devastated our nation in terms of heroin and overdoses. 33,000 people, again, dying of overdoses due to opioids and heroin. So in the heroin use, it's a lot cheaper to get heroin, so that's where people go from being addicted to narcotics. They can't afford the 40, 50 bucks a pill on the street. They go and they got to go to heroin, which is a lot cheaper, and that's sad. So we need to find effective ways to help these people who are suffering with addictions, get them healthy, get them well. And you know what? When it comes down to it, the family here in Clarksville, Andrew Fox, veteran grown, give them a call or stop by my office. We're carrying their products, their CBD products, because it's a truly amazing story that this man would drive cross country, risking life and limb. You know, in essence, driving on the highway, sometimes you risk your life and limb. But you know, to find a way to get his wife well and not see her addicted to narcotics and just, you know, drugged out of her mind after a back surgery from being hit and struck by a car while they're on vacation. But God really can use opportunities like that to really show somebody their purpose. And I think Andrew Fox has really found his purpose in life in terms of showing people a, you know, a herbal remedy, a wilderness remedy right there. You know, God created it. We just need to figure out how to properly use it and not abuse it. But when it comes down to it, hemp is not addictive. It is not something that you can get high from. It's CBD. And again, I've got a United States patent on cannabidiol. the beneficial effects of this all the way back in 1999. The United States actually patented cannabidiol and cannabis. So they've known for a very long time, even though the DA wants to try and say that it's a Schedule I drug. It is not, because the classification, the definition of a Schedule I drug means it has no medicinal properties. But in fact, we'll be reviewing some research, whether this show or the next show. But again, we carry that. Check out our hours online on Facebook there, or go to thewilddoc.com and subscribe there, as well as find our office hours. So we'll be talking a little bit about that as well. All right. So irritation of the spinal nerves as they leave the cord. So what this is talking about is they talk about how the spinal nerves may have tension on it. So with scoliosis, you have a convexity, you have a curvature on the spine, where the greater distance, or the distance of the spinal nerves is increased. The distance the spinal nerves have to travel is increased on the outside of that curvature. So when the spine shifts in scoliosis, or even not necessarily classified as scoliosis, when it's under a 10-degree curvature, a lot of times they won't classify it as scoliosis, so you may have curvatures of your spine. One way to tell whether you have those curvatures is look in the mirror, and if you see uneven shoulders, you've definitely got curvatures of your spine. If you feel like one leg is shorter or longer than the other, if you feel like your hips are one's higher than the other, you're going to have curvatures of the spine. So we need to check that. We need to correct those, because ultimately if we leave the spine out of alignment, it's going to cause organ malfunction over time, whether now presently, and we have tests to verify that, whether it's actually impacting the organ function and the nervous system function, or if it's right now simply caused a misalignment. Yet if we leave those misalignments, like if you left your car tires out of alignment, what's going to happen, folks? It's going to cause wear and tear, and eventually more and more pressure accumulates on those nerves, and now we got health problems and organ malfunction. Because again, all the way back in 1930, the irritation of the spinal nerves as they leave the cord, whether within the confines of the bony canal or just outside it, is shown to produce somatic disturbances in the levels innervated by those nerves, by these nerves. So the nerves leave the spinal cord. If they're irritated, if they have more tension, or they have pressure on them from arthritis and deterioration over time, or just the misalignment alone, if that irritation occurs, it changes the tone. So the brain's impulse is no longer able to be sent through that pathway properly. It's changed, it's distorted, it's disrupted at that spinal level, at the level of the misalignment, and then thus that nerve does not transmit the proper signal to the organ tissue. It can cause neuralgias, pain, and ultimately organ malfunction. Cervical involvement was associated with headaches, and what I do with this, again, what I do with the research here is I like to speak from research so that it is not my opinion here. You can always find out my opinion by just watching enough of my shows. But the cervical involvement was associated with headaches, sore neck, pain in the shoulders, the arms, precordial, that would be tissue above the heart. I'm sorry, I hit the mic there, probably making some weird noises online. Precordial pain, so pain above the heart, which oftentimes thought to be, the patient would think it was due to the heart, was found to be due to the osteoarthritis, so arthritis of the upper dorsal spine of the upper back before you hit the neck. Pain in the gallbladder would be, or epigastric, upper digestive tract area, so just below the sternum. Areas was noted when the mid-dorsal area was involved, appendicitis, pelvic disease, so female disorders, were elements in differential diagnosis of lower dorsal, the lower mid-back, so it'd be still the thoracic spine where the vertebra and the ribs are attached. So in that region of the spine, so that lower region would affect and cause appendicitis and pelvic disease. Those areas would be affected. All the way back in 1927, investigated Carnett, a physician by the name of Carnett, had investigated the follow-up reports of operations for chronic appendicitis, gallbladder disease, done by a large group of capable surgeons, found that the fairly high percentage of these patients was not relieved by the operation. He stresses the importance of distinguishing between abdominal pain due to intercostal neuralgia, so intercostal nerves, the nerves that have to branch out through the thoracic spine and go along the rib cage. Intercostal nerves would cause discomfort and pain in the rib cage or in the tissue connected to the rib cage. We must distinguish between the abdominal pain due to intercostal neuralgias and that caused by the appendix or gallbladder. A brief mention is made of a girl whose chronic appendix and later whose apparently normal right ovary So if you think about this, I mean, I don't know if you can see me on Facebook or not, but the reality is she's got appendix pain, right lower quadrant pain, and over time it eventually went into the right ovarian area, and she had those organs removed. And having those organs removed didn't fix the problems. She had, at that moment in time, those ovaries, structurally speaking, microscopically speaking, had no full-blown disease process, so they didn't need to be removed. So removing them didn't fix anything at all, yet she underwent that surgery. When afterwards correcting her spine is what relieved her discomfort. Her abdominal pain was corrected, so they got to the root cause. We must evaluate the spine. A brief mention in May that girl appendix, later apparently right ovary was removed, right, cited symptoms and operations. It was then found that she had lateral curvature of the spine, a shortening of one leg. So when people go to a chiropractor, oftentimes they're like, why is that doctor like looking at my feet? Why is he like playing with my feet, looking at my leg length? It's because if one leg's shorter than the other, what we're doing is we're evaluating, is one side of your spine tighter? Is it because of the misalignments of the pelvis, the lower back, or is it because of upper cervical misalignments can actually cause muscle tension all the way down the kinetic chain, then in essence pulling that leg short? And if we do that, and we do a very specific job at correcting the alignment of spine, we'll see those leg lengths equalize. And through that process, we can see that the spine is corrected, the nervous system had a good response to that adjustment. We go do some exercises to help strengthen, and ultimately taking care and taking that pressure off the nerve, returning brain-to-body communication. The pain was remedied, and her pain ceased. So after correction of her spine, see, orthopedia, again, is the Greek terms, two Greek terms, orthopedia, ortho, straight, upright, upright position, orthopedia, pedia meaning child. It was the original purpose of those physicians to evaluate to make sure a child was growing straight, growing upright. So we need to get back to that day and age where all our children, every single child, I'll tell you this, why do I tell people every single baby, every single child? I mean, seconds after, the first thing we did when my children were born, my two babies, I immediately, as soon as I got my hands on that, I literally kissed their forehead, said I love my child, and I immediately checked my child's alignment. Why? Because even the birth canal process, even pushing through that birth canal can be traumatic to the cervical spine, compressing the neck. And if those misalignments remain there, not only can they cause dysfunction in the organs, improper development of organ systems, and discomfort to that baby. So now we have a colicky baby, we have a whiny, fussy, crying baby, we have a baby that is in pain and suffering, yet they can't speak to us and tell us what's wrong. All they can do is cry, and then it drives mom and dad nuts because they can't stand a baby that they just can't comfort their child. And yet, how many babies have I been able to adjust over the years? And adjust that baby, and it makes a world of difference for mom and dad. For the entire family, stress level goes way down because baby's sleeping at night, baby's comfortable. You know, these babies can have headaches. They can't tell us that they have headaches, but they can have misalignments, and misalignments cause headaches, they cause migraines, and oftentimes we'll see these babies that are pulled out by forceps, that they have vacuum extraction, they have traumatic births, that they have difficult birth process, or they're stuck in the womb in one place, in the location, so their head's up here, their torso's down there, and they're stuck in that. They don't get to move around because mom's pelvis is out of alignment, and through that process, you know, they're causing misalignments because they're stuck inside that womb in one position, so it causes shortening of the ligaments and muscles on one side, lengthening them on the other. So if we begin to correct those alignments of the spine, that baby will be more comfortable. That baby will end that suffering for that baby. That baby will be healthy again. You know, going as far back as the research that shows that injuries to the cervical spine, such as forceps delivery, that traumatic births were connected and correlated to SID, sudden infant death syndrome. Sudden infant death syndrome is where a child dies, quote unquote, unexplainably. But there's massive research pointing towards the direction of traumas during the birth process and that ligament damage to the upper neck. So if we damage that spine through that birth process, or maybe baby rolled off of the changing table and hit their head and it just shoved their neck out of alignment, we've got to get their neck checked. We've got to get it back into alignment, because if a major misalignment is well established to cause breathing disorders and cause the breathing reflexes to be shut down, because of pressure on the brainstem. If we don't correct that, if a major misalignment could take a child's life, what about a minor misalignment? It causes them to have less life, less, you know, enjoyment, less fulfillment. They don't get to live up to as much potential as they would have had they been able to have that alignment corrected at a very young age. And also, just talking about arthritis, deterioration, the research shows about 10% of 10-year-old children have signs of deterioration and arthritis in their spine. By the time they're age of 13 years old, it's 1/3 the population has arthritis and deterioration occurring in their spines. And that's even when their joints are still vascular, still have direct blood flow. After maturity, though, after puberty, we no longer have direct blood flow into our joints. We have to keep our joints moving to push nutrients in and waste products out. We have to move a joint. So that's why adjustments are so beneficial, of just mobilizing and keeping those joints properly moving to prevent arthritis and deterioration. So just in that concept, if these babies are growing, if these children are growing, and if they're not in an upright and straight and orthodox position, an orthopedic position, you know, if they're not upright and straight, that alignment of their spine is out. If they have abnormal pressure because their neck is out of alignment like this, and then the curvature of their spine compensates for that, here's primary misalignment, shoving the head out of alignment. Now their head's off center, so they're going to want to lean their head to one side so their eyes and ears are parallel to the horizon, and then the scoliosis occurs in the back. If we don't correct this right here, there's going to be abnormal pressure on those bones, and over years they've shown that it can actually cause wedge shapes to the bone, the vertebral body. So the blocks that are the structure of our spine, the bricks of our spine, those bricks will be forming in wedge shapes. Imagine what that does now to the health of that individual over the years, the likelihood of major arthritis and aches and pains and debilitation and disability. You know, another research study that I had pulled here, since I knew I'd talk a little bit about scoliosis. It's an orthopedic Scandinavian journal from 1968. Long-term, I'm getting into the classics here of the research right now. And look at this. So the long-term prognosis, what's the future look like for a child or individual with severe scoliosis? So I just have to mention this just because the title says it. It's the title of the study is Long-Term Prognosis in Idiopathic Scoliosis. I always laugh. Idiopathic. At times we may not know exactly. There's been shown things like cerebral palsy, strokes, traumas to the brain can cause scoliosis because then it weakens one side and the muscles aren't equal on either side, and scoliosis can form from that. They've even shown vitamin deficiencies, like B vitamin deficiencies, to potentially cause scoliosis because of B vitamins are essential for elongation and growth of the central nervous system, and if that central nervous system doesn't grow properly, then the spine has to buckle on itself to take tension off of the nerves. I'm being signaled we have a question online right now. Anthony, go ahead with that question, or you want to hand me the phone? I see it here. Give me a second to bring up.
Would Parkinson's be treated with chiropractic?
Can Parkinson's be treated with chiropractic care? And I'll have you check out on my computer why I'm not seeing those questions per se, but let me look it up here really quickly. I mentioned that the last show, that yes, Parkinson's disease could actually be caused from misalignments in the spine. There was a case review of 81 patients. Right, here we go. So an original research study done by a chiropractor in Boulder, Colorado. 81 patients with multiple sclerosis, so MS, and Parkinson's disease, undergoing upper cervical chiropractic care. Normally upper cervical chiropractors are great for the upper cervical alignment. They get very, very specific. I take all those techniques, or as many as I've been trained in, and we get very, very specific, especially when we correct scoliosis like I was talking about. We get very specific with the upper alignment. The upper cervical spine is basically your skull, your atlas, C1 and C2, sometimes incorporating C3. That upper cervical alignment is very critical because it's right at the brainstem. Really driving the position of the head can drive the position of the rest of the spine. So if we correct head position, we can oftentimes correct the rest of the spine and improve that. But Here are some of the findings after administering treatment to correct the upper cervical injuries. 40 of the 44, 91% of the MS cases showed improvement. 34 of the 37, 92% of the Parkinson's disease patients showed improvements, and they had over a 50% improvement. Maybe I'll do a show on Parkinson's disease because there's multiple contributing factors, but one of the number one contributing factor they've seen in Parkinson's disease, they've correlated to head and neck trauma. So if the head and neck is injured, it really can cause neurological inflammation, and the inflammation can then go to the brain. It can be a feedback mechanism from injuries and traumas of the spine causing neurogenic inflammation. The brain becomes inflamed. They've even shown that people that have degenerative disc disease in the lower back, the lower back is degenerating, that the lack of movement can downregulate the amount of electrical energy that is produced through spinal mobility and through spinal movement. That's why we got to move, and especially got to keep our spine moving. But they've shown that to cause atrophy of the brain and cause neurological disorders. And same thing with like Alzheimer's, dementia, those types of conditions. I've seen people improve with consistent corrective chiropractic care in that area. There's also some research out there in terms, because I just pulled up my we'll have to do a Parkinson's disease one. Correction of chiropractic, multiple sclerosis and Parkinson's, 81 patients. Improvements in multiple sclerosis in a female with vertebral subluxation correction, so correction of alignments. Paraspinal asymmetries in Parkinson's disease, and reduction of symptoms after upper cervical chiropractic care. I've also seen that the digestive tract and the health, leaky gut, is another factor. Hippocrates said, look well to the spine for the cause and prevention of a disease. He also indicated that disease begins in the gut, not necessarily that disease is caused by the gut, but yes, eating the wrong things, causing diseased gut can ultimately lead to other malfunctions in the body because of malnutrition or the absorption of toxins because we don't have a proper barrier there in our intestinal tract. Through good probiotics, good intestinal flora, and a impermeable or a selective permeability of our digestive tract is critical for health as well. So we need to take care of that. But this study on long-term prognosis of idiopathic scoliosis, there are a number of general statements in several research studies they point to here. The effect that patients with severe scoliosis, they generally die before the ages of 45 to 50. The deformation of the thoracic spine impairing the heart and lung function, and thereby resulting in increased mortality. So powerful, powerful statement there. Now, I'm not sitting here trying to tell people out there that, hey, if you got scoliosis, you're going to die early. In no way, shape, or form, and I'm wanting to tell them that. What I'm trying to show them is if they have not been led down a path to understand the importance of that alignment of their spine, not just in a symptomatic realm, not just if your ortho or your doctor nowadays, your medical physician, or even your chiropractor says, hey, yeah, your scoliosis, we'll monitor it. Monitoring scoliosis is like saying you live in the Florida Keys and you're going to monitor the hurricane that's coming straight for you. That's retarded. I'm sorry, bad word sometimes, but that is the dumbest thing we can do, is sit there and monitor something that is well established to cause serious health problems in the future of that individual. Monitoring things is somehow taken hold in medicine. That, oh, your knees aren't bad enough yet for surgery, so we'll wait until they're bad enough and then we'll do surgery. Why don't we talk about the things necessary for cartilage regeneration, for joint health, for proper structural alignment of the knees and the ankles because of pelvis and lower back, as well as ankles. I mean, I adjust ankles, I adjust knees, I adjust pelvis, lower back, I adjust the whole kinetic chain there because the biomechanics of your body are very critical for the health and function of not only joints, but organ systems as well. So critical we do that. We've got to get this information out there to people. So make sure that if you're a young adult right now and you want children, make sure that you're getting them checked for scoliosis by a professional chiropractor that is really looking well to the spine to prevent those misalignments, allowing them to grow healthy and straight and in alignment. And if you know you have scoliosis, please, please, please seek out the care of a great chiropractor that does structural correction. One of the best institutes, I believe, out there for scoliosis correction is Clear Institute, clearinstitute.org. Go to their website. You can email me. I'll point you in the right direction the best I can. But that's the type of care that I provide. I truly believe in it because I've seen it help so many young women especially, because you have roughly 70% of women, 70% of scoliosis cases occur in women, oftentimes because they grow structurally. Their skeletal system grows faster than typically their muscle system. Boys usually have stronger muscles. They have more well-developed muscles at a younger age. Thus, they have less likely of having major misalignments that ultimately lead to scoliosis. So that's ultimately why girls, they grow tall, thin. They don't have a lot of muscle development to stabilize those joints of their spine, so they get shifted out of alignment. So when you're working on those young girls, we need to make sure that we adjust them and correct the alignment of the spine, but then we need to really strengthen to get them to hold in alignment. Without that, it's very difficult to actually change their spine and improve the structure. An adjustment would be great, but we don't want to get in that realm of over-mobilization, too much mobility. We want strength, stability, and mobility. We got another question online. I don't know, my computer doesn't upload those questions. I don't know. We'll see. Everybody online, Middle Tennessee. I got people from London listening? Holy cow. That's amazing. That's awesome.
They want you to comment on Elizabeth Avon's comment.
Elizabeth Avon's comment. Okay.
Yeah.
I'll check out Elizabeth Avon's comment here. Now, did you share that, Anthony, online? And everybody online, listen, we're getting through this. We're figuring out the technology here the best we can. Oh, wow, 38 comments already. Elizabeth Amon. See if you can pull up it and just point to it. I'll keep going with this, and then we'll get to that question here in a minute. So I said I was going to go through several of the cases. I want to read these quotes here from, again, this research study done in 1933. In other words, instead of starting with a pathological viscus and tracing the path back to the area of the spine, start with an abnormality of the spinal configuration and designate it as the primary cause of visceral disturbances. So what they're saying here with this highlighted sentence and statement here in this research is they're saying we need to start with looking at the spine first. Again, go back to Hippocrates. Look well to the spine for the cause and prevention of all disease, because it's so important, that structure of the spine. So they're saying we need to look at that as the primary thing first before we go in and cut out an organ, a malfunctioned, diseased organ. You got it right there, the top one? Elizabeth Avon. Parkinson's is often Lyme disease and co-infections, not only from ticks, but doctors use the wrong tests. Same for MS, ALS, CFS, fibro, autism, lupus, others. Strange but true. Now,
It says Alzheimer's too.
yeah. So what I've been seeing there is that Lyme is something that causes chronic inflammation, causes a lot of immune disturbances there. It can weaken the immune system, also just cause it to basically, I call it like a smoldering effect in the body. But I always ask the question, there are people that overcome Lyme disease, that get bit by a tick, have Lyme, but have no ill effects from it over their entire lifetime, or at least the majority of their lifetime. It's usually going to weigh on them to some degree. It's going to have some negative effect on their overall health and well-being, but not to the degree of causing MS or Parkinson's. So we have to go back to what really allows our body to develop a disease, a condition. So Lyme could be the triggering effect that puts the person over the edge, ultimately leading, being like the primary trigger, like it's the primary thing that just sets it off, is the straw that broke the camel's back. But again, why can some people be bit by a tick, have Lyme disease, but never develop into the chronic, to where it causes the severe neurological and chronic, debilitating, sometimes deadly health problems seen in many other people? It's your resiliency. It's how your body is capable of adapting to stress and to its environment. Put this into perspective. What they're seeing in multiple different research studies right now, it's one of the leading areas of medicine and medical profession, really looking into how do we evaluate this, the function of the nervous system, and how do we actually correct the nervous system, correct this measurement. They're looking at adaptability, the ability for the body to adapt to stressors. One way I explain this to my patients is, if, listen, we're walking through the jungle. Whoever can adapt better when a tiger, quote unquote, the tiger is stressed. The tiger could be Lyme's disease. The tiger could be a exposure to a toxin through whatever manner possible, whether it be vaccine, whether it be a medication, whether it be to environmental, such as pollution. Why does somebody live in a home with mold and have chronic health problems from that? Meanwhile, their spouse seems to be perfectly fine and healthy without any serious chronic fatigue and health problems, fibromyalgia from the mold. Well, it's their body's capability of adapting. And what they use is heart rate variability studies. And they're now showing, even to the degree we're using heart rate variability. The Russians used it for selection for their special forces in the military. They'd even use it for evaluating their soldiers before deployment because they wanted to make sure that their soldiers were able to adapt and be healthy before deployment. And they do these heart rate variability studies, and they'd be able to show that their body could adapt to stressors. Thus, they'd have a greater capability of reaction times. They'd be better speed on the trigger. They'd be better able to adapt and fight. They'd actually even be better off if they happen to have a gunshot wound, if they happen to be traumatized. So in medical evac, in transportation by helicopter, so in critical care situations, doing heart rate variability, they can actually see that if somebody with a higher heart rate variability, meaning their nervous system was adapting at a higher degree, with similar traumas, they would be far more likely to survive that trauma. So gunshot wounds, other things. They even did these animal studies where they'd actually puncture the intestinal tract. So systemic infection from feces and junk leaking out of the rat's intestines into the rat, 100% mortality. But through vagal nerve stimulation, through increasing heart rate variability and adaptability, through a electronic device, they'd actually save about 50% of the rats. Pretty cool research there. Now, how does that play in part to chiropractic? Why do I measure heart rate variability? Because I want to see somebody's adaptability to be able to increase. So that way, no matter what they come in contact with nature, Lyme's disease, malaria or the flu or pneumonia, or the child has asthma, or their child has a twisted ankle, or somebody, God forbid, a gunshot wound, they're better capable of adapting, they're better capable of surviving, they're better able to overcome that stress in their life. Whatever the stress may be, chemical, physical, mental, situational, emotional, doesn't matter. How well can you adapt to that stress? How well can you roll with those punches? And that's up to your nervous system. Your nervous system takes in information. We have sensory system that takes in information from an injury, a trauma, to an infection. It takes that information in. It coordinates with the brain. The brain coordinates that information. If it can adapt better, it sends down the signals for the immune system to properly respond to that infection, such as Lyme's disease. So what I see in Lyme's disease is there's multiple contributing factors there, and Lyme's disease is one of the biggest. You got to fight that. You got to get rid of that chronic infection, that smoldering infection, but you also got to figure out, why was that person unable to overcome the Lyme's disease? Can we really say that in this day and age, in this world, there are people with HIV that have no serious negative effects to their health or their life ever, yet they had HIV positive infections. Why can that be? How can that be? HIV is this horrible disease. It is a stronger, same with Lyme, it's a stronger infection against our body. It takes more for the body to overcome that infection. So how do we enhance? Always think about, how do we enhance the body's immune response, the nervous system response, the adaptability, and get to those root causes? How do we encourage the body to overcome that infection? And I've seen that. I've had patients that have tick bites that have been confirmed Lyme disease. As we start adjusting them, you see this massive improvement in their physiology and their health to overcome, because what we're doing there is we're enhancing the nervous system's capability of fighting off that infection, because the body can do it. We just need to give the body all the right raw materials. That's why nutrition and supplementation is utilized in many alternative clinics. Then we look into the ways in which they're using hyperthermia by boosting the immune system, by revving up that internal core temperature with hyperthermia. I always call it, back in the days of the American natives, the American Indians, they used sweat boxes and sweat houses, and they'd sweat it out and they'd detoxify through that process. Nowadays we get these saunas. So all those ways to enhance or encourage the body's capability of adapting or overcoming that infection. So hopefully I answered that question to a degree that suffices to those individuals. Any other questions you think we should answer right now online there on Facebook? Sometimes it's tough for me to go through each and every one.
Autoimmune disease. How can chiropractic help with autoimmune disease?
Autoimmunity. So I like to first reference a lot of what we have available to us in the research, and then we can go into really explaining it on another level. But there's research right now that shows a lot of times you'll have significantly elevated levels of inflammatory cytokines. The immune system releases cytokines in response to infection or trauma. The body's using the inflammation, those cytokines, to kill off invaders, bad bacteria, viruses, but it goes without regulation in autoimmunity cases. So the autoimmune response is an elevated, out of control inflammatory cytokine release by the immune response. Thus, it's lost, the nervous system has lost control of that proper response. And several studies have shown that chiropractic care, specific adjustments to the spine to enhance the parasympathetic, usually is what you need to do with that. You need to enhance parasympathetic by focusing on upper cervical alignment, has one of the largest effects, but even removing pressure and stress that causes neurogenic and inflammation and an improper immune response. There's a journal I have on my computer that I love to reference. I'd have to look it up for future reference and shows, but it's an online orthopedic journal, Journal of Surgery online, that actually showed that spinal misalignments and with orthopedic and chiropractic and structural correction of the spine, overcoming immune disorders, eczema, autoimmune type conditions, psoriasis, skin inflammation, overcoming those through balancing out the immune responses in the body once they corrected the structure of the spine. But they needed to correct the structure of the spine. It wasn't just mobilize the spine. So it wasn't just a manipulation or a pop or click of the spine that did it. It was a specific adjustment to relieve pressure, tension, and stress on the nervous system. If that occurs, then we have an enhanced immune response or an improved immune response through improved nerve function and less neurological stress. And that's why the research there really connects on a physiological level, how chiropractic could help and aid in those conditions. Also, when it comes down to if your brain and your body are communicating back and forth, the brain is like central command. It's the main control center. So in the military, you got central command. They need to be able to radio and communicate out to the ground forces, the immune cells, and then you got the airplanes, the jets that fly in or the helicopters that come in, and they're going to lay down covering fire and just create havoc and inflammation and lay down the napalm. So what if the communication from the ground forces, radioing back to central command, radioing back to the brain, if there's spinal misalignments, you already have a distortion in that communication from the ground forces through the spine up to the brain that is already distorted, so they don't receive the signal quite right because it's distorted at that misalignment in the spine, and then the brain tries to communicate back down the spinal cord and then out those same nerve roots back to that area of the body, out to those ground forces, again, the immune system, and they're trying to radio back and forth and communicate, and then they're trying to communicate and coordinate with the aerial attack, and the aerial attack is coming in, and they're going to lay down that napalm, that inflammation, those cytokines, and they don't get that quite right, and then all of a sudden, bam, we've got friendly fire, and we're attacking ourselves on accident. Well, we got to have that proper communication in autoimmune disorders. We've got to get that. What we see with things like autism and other autoimmune disorders, I normally see in my clinic that they have multiple contributing factors. Normally they'll have some form of spinal trauma. Oftentimes I'll see whiplash injuries, car accidents. Sometimes I've seen people fall off of horses. I've seen people that jumped in a pool and hit their head. One of my patients that was Holly on the last show, she was commenting quite a bit. She's had a lot of intestinal disturbances and health problems. She's had the organs removed. She's had back surgeries, and then she's seeing the most benefit here, but she's been through years from a teenager. And she told me one of the things she remembered as a teenager before she had these problems was she literally said she was going to diving class. So she's learning to do like diving in the pool, but then she decided when she was really young, she was going to practice on the couch. Didn't realize that the couch, the cushion only gives so far, and she dove into the cushion of the couch off the arm, jams her neck, passes out. The dog is licking her face when she wakes up. She says the first thing that popped in her mind was, oh my gosh, my parents are going to kick my butt. Whoop my butt is what I think she said, actually. But she's like, you know, that trauma, and it's like, because she has so many shortened ligaments on one side, she has so much arthritis on one side of her neck, guaranteed that trauma took place at a very, very young age. And I pray to God every child that ever has something similar to that happen gets immediately evaluated by a chiropractor and gets that spine corrected before it causes all these serious chronic health conditions later in their life. So, that's really autoimmune in what we're looking at, and that's how we see so many people improve, because you improve adaptability, you give the body the right raw materials, you feed it right. You may have to eliminate stressors, and I oftentimes see that they have situational stress that can trigger it further and further. Divorce, a loss of a loved one. So there's psychological traumas, emotional traumas there, and oftentimes we'll see that there's a toxic overload too. We find that people are exposed to mold and different things like that we've got to get rid of. So I love the questions. This is definitely what I want to do. Any other questions, keep them coming there, Anthony. Thank you all for participating online. Hey, Holly's online, definitely. Got Michael. Thank you for tuning in, sir. Good stuff. All right, so from above considerations, it would seem, so back to the original research here, from the above considerations, it would seem possible then that symptoms of the gallbladder disease, appendicitis, stomach ulcers, gastritis, partial urethral obstructions, colitis, spastic constipation, and other forms of visceral irritation are may be produced directly or indirectly from spinal curvatures. So spinal misalignments causing all those cases or all those conditions. Case 1, upper abdominal. I always laugh at back in the day. So case 1, a professional man, white, age 31. In case two, a Jewish grocery clerk, age 42. Case 3 was a draftsman, white, age 33. Fourth case, I just thought it was funny that they had to point out that it was a Jewish grocer that had all these health problems from spinal misalignments. And then case 4, a woman teacher, white. I definitely see a lot of teachers have chronic health problems because of spinal misalignments, because of poor posture that they have to take on from studying, and grading papers all day long. So definitely need to take care of their posture and their alignment of their spine. So case 1 had upper abdominal distress, so upper GI, intestinal tract distress. At times, the symptoms became acute, colicky in nature. He vomited. This was almost projectile type vomiting. I'll see this in babies, and we start adjusting these babies. We correct those misalignments, and boom, they stop this projectile type vomiting. Literally could save the child's life, not have to be, I've seen babies that were literally having to go in and have tubes periodically inserted into their stomach to actually feed them. So feeding tubes were inserted because of projectile and chronic vomiting. They couldn't hold down nutrition. And then it just breaks my heart when I see that so many of these so often we'll see that doctors recommend stop breastfeeding. Stop giving the baby the God's most nutritious food the baby could possibly have, and go to formula soy and GMO soy. And they tell them to do that. I'm like, are you kidding me? Figure out why the child. It's not throwing up because mom's milk. That's never why. Unless mom is feeding themselves horrible and the baby's body's like, this is poison to me, which is literally GMO soy would be far worse. So this was almost projectile. They complained of feeling an effect of gas caught in his intestines near his stomach. He was forced to go to bed for several weeks at a time because of the pain. They found dorsal or mid-back scoliosis in 1923, and I'm paraphrasing here. In 1923, they performed and essentially normal appendix was removed. They performed surgery, appendectomy, removed this appendix, no problem. In short, the patient was known to have had this symptom of these pains, the right side, since 1923, and an noxious appendix was removed. No problem with the appendix at the moment. 1930, when he obtained relief of the intercostal pain, so they corrected his spine, the colic and the other intestinal problems resolved after correction of the spine. Gastrointestinal series study showed normal bowel retention. Case 2 here, this Jewish grocery clerk, age 42. Again, this is a 1933 study. I think that's why they really go into detail of explaining who this person was. So at this time, I don't think it really mattered that he was Jewish, but I mentioned in 1921. So observed since 1921, at this time, he was complaining of feeling tired, weak, even after sleeping long at night. So if you sleep 10 hours a night, you sleep 8 hours a night, you can sleep through half the day and you always wake up tired, you've got a high sympathetic tone, then your spine has got to be out of alignment, or there's some other triggering factor that is driving up that sympathetic, that stress response. Got to get it corrected, and that's what they found with this guy. He was diagnosed with appendicitis as well. He had cramp-like pains in the abdomen. He had a backache. No nausea, vomiting here. Bowels were regular. Retrograde gastrointestinal tract taken at the time were negative, so they didn't see any other problems with the intestinal tract. Dorsal-lumbar curvature was found, one leg shorter than the other. After correction of this, he improved and showed considerable improvement in his pain, all problems relieved. Case 3, this draftsman, age 33, actually 23, since 1930, emptiness in the stomach, nausea and epigastric pain, colic, double pneumonia in infancy. So his history, and this is the thing, he's got a little girl. This little girl's testimony is amazing because she's able to actually no longer have to, for almost a year and a half now, hasn't needed to go back to the medical physicians to be put on antibiotics after antibiotics after antibiotics. Why? Because we corrected misalignments of her spine. And same thing with this guy. So I wonder, man, we could have helped him as a child. Severe attack in 1918 due to the flu. Dorsal-lumbar, and that's another thing, is the misalignments of your spine will weaken your immune response, your capability of fighting off infection. So that's why chiropractic literally could do no harm during the 1918 flu. Saved thousands of lives were saved because of correction and specific alignment and adjustments of the spine. Orthopedic relief of the curvature of the spine, again, orthopedic, straight upright. Curvature of the spine was corrected, almost immediate relief of the abdominal and upper gastric pain. A woman teacher, white, 37. She had been told by physicians that the pain was caused by her left ovary. The left lumbar, right dorsal spine curvature was found. Correction of the curvature brought total relief within 3 days. And this is research all the way back in 1933. Tickling in her throat, chest, cough in another case. Difficulty breathing. She also complained of constipations. Bowels weren't moving well. Difficulty in every 2 or 3 days. She had a miscarriage at 2 weeks in 1927. She had tonsillectomy prior to that. She had cervicitis, so she had inflammation of the lining of her cervix and the external part of her cervix. They found scoliosis was charted. They corrected that scoliosis, and she was able to then get pregnant and have a child. Like, look at that stuff. She then literally went back to normal urination. So all this area, she had misalignments in her lower back, the nerves branching to a reproductive system, causing a loss of a child. And I've seen this. I had a girl, 25 years old, never had a cycle in her entire life. Within the first month of correction of her scoliosis, she had a cycle on her own with no drug assistance. So I've seen women that have bleeding and they had their cycles for like literally half the month. Or more than that, they bleed excessively, and when we correct the alignment of their spines, they no longer have bleeding, and they go back to a normal 3-4 day cycle. So really need to check into that if you're having those problems. Samantha, your advice for someone who has already had their gallbladder removed would be to continue to care to support that organ. Yes, so that's the thing, is if we remove an organ, we remove the tonsils, I really used to talk a lot about that in regards to this subject. Like, what should you do if you had your organ removed? Well, I'm going to do it. Hold me to it. Email me, message me, say, Dr. Dale, I need that list in writing. But I first off tell people to go ahead and start utilizing things like coconut oil, because coconut oil, that saturated fat right there, when you have your gallbladder removed, you no longer release bile into the intestinal tract, and bile is necessary for proper absorption of fatty acids. It's necessary for the absorption of essential fatty acids and essential fat-soluble vitamins. So you become deficient in certain vitamins and minerals oftentimes. You become deficient in certain healthy fats. So coconut oil is something that doesn't take. It's easier absorbed through the intestinal tract. So utilizing coconut oil for your cooking purposes and just supplementing practically with that, consuming more of it. I would highly recommend if you've had your gallbladder removed. To counteract the increased risk of, they've shown increased risks of cardiovascular health problems, and they've seen an increased risk of pancreatic cancer. And what I'm seeing there with the research there, due to the, are we still online? I kind of see a glitch in my computer. We're still online, right?
Yeah.
Make sure of that. So what I've seen is, why would there later be an increased risk of pancreatic cancer or pancreatic problems in someone with a gallbladder? Well, the misalignments, the spinal region where the nerves branch out and go to the gallbladder is roughly the same area where the nerves branch out and go to the pancreas. So the gallbladder was the first organ to have the most dysfunction caused by those misalignments. Well, if they just remove that organ and that spinal misalignment is not corrected, now we're going to have health problems in other regions or other organ systems and more malfunctions. So highly recommend definitely get your spine corrected there. Have it evaluated, have it corrected there so that you don't end up those misalignments overlooked, never corrected, now health problems in other organ systems and health problems. And that's the other thing they stated in here. As people would go through spinal correction, oftentimes they'd go from gallbladder discomfort and then the pain would move. They'd end up with constipation for a couple weeks as spinal correction was occurring because they're changing the spine, and then over time the constipation completely removed and they had full return of function to all organ systems and relief of their symptoms and problems. So, again, if an organ was malfunctioning, find the reason why. If a child had their tonsils removed, studies in Denmark showed that 82% of children could save their tonsils if they were adjusted by a corrective chiropractor. Very specific chiropractic alignments to the upper cervical spine where the nerves branch out and innervate those glands. If we don't correct those misalignments and we just remove the tonsils, well, my feeling on that is that if we see an increased risk of cancer in people's lives who have had their tonsils removed, we're going back to we didn't address the underlying cause of the tonsils being inflamed, of the immune system never being able to fully fight off infections, and just having this chronic reoccurring infection after infection. And you may remove the symptoms so then they can breathe easier and they don't have the inflammation, they don't have the sore throats. But what they see is they see a lowering effect of their immune system. A programming is lost then for future benefit of being able to fight off a cancer, because our immune system does that. It fights off cancerous cells in our body. So we still need to correct the underlying cause. We still need to get to those children and correct the alignments of their spine so that they don't grow up with lower adaptability, lower function of their nervous system, and ultimately looking at more and more health problems. And again, that's why I'm advocating for a major change in the way we are looking at our health individually. We need to look at what is the body lacking? What have we been exposed to that is causing stress on our body in forms of toxic exposure or even situational emotional exposures and situations that have caused stress on our body? What is our body lacking in forms of nutrition and nutrients? And not just saying, hey, we have low iron and let's supplement with an iron supplement. Usually there's other problems of why. The macronutrients oftentimes are not necessarily the problem. They cause problems, but they're not the problem. The problem is, why can one person eat tons of spinach? Cooked spinach is best for iron absorption, but cook a ton of spinach, douse themselves with iron supplements, yet somebody eats cheeseburgers every day and has no problem, even though red meat has a lot of iron in it too. But actually, liver is one of the best things to eat. Healthy organ meat is the best ways to improve iron levels. But that's temporary. We need to figure out, why can't this person absorb, utilize the right amount of iron from the nutrition? It's like juicing and doing these things. They're great for assisting the body during certain periods of time. But the reality is supplementation And juicing and doing those things periodically can be beneficial, but the reality is we got to seek out why. Why can't their body adequately absorb the right amount of nutrition, nutrients, minerals, vitamins, those things? Seek that out. Is it the spine? Are we being exposed to toxins? Do we not have the right gut flora? The probiotics, how do we replenish those things so that our system gets back into normal, healthy function? And we don't become dependent on supplements. We don't become dependent on those things. We need to restore function and healing and then do the things like nutrition, live a healthy lifestyle, enjoy life to the fullest, have a cheat day now and then with nutrition, but really, if you're functioning and healing, because there's those people that can smoke a pack of cigarettes every single day, drink a fifth of whiskey, eat bacon sandwiches from GMO grain-fed pigs and swine, and yet they never have an GMO and chemically sprayed wheat on their bread, and they never end up with health problems. Their body's adapting far greater. It's a guarantee. If their body's adapting and can adapt to those stressors, those chemicals, those toxins, that stress, that inflammation they're putting their body under with that poor nutrition. I'm not advocating for just correct your spine and then live a horrible lifestyle, but what I'm saying there is that is the impact that a properly functioning nervous system can have. If we look at that and then we look at all those other contributing factors to disease, such as Lyme's disease, great information out there. And really it's the natural healthcare world is really coming to a on that subject of Lyme's disease and really beginning to see there are professional doctors getting out there and correcting those things and working on overcoming chronic infection from Lyme. So I love the interaction with all those out there, Samantha, Holly, everybody there, Michael, and I do apologize if I didn't mention your name, but I thank everybody for tuning in, Margaret, here on the Wild Doc, and Crystal, just Jacqueline from California, just keep Dieter, I hope I pronounced the name right there, Chris. But thank you for the questions. Again, I will try my best to answer questions in the future. Thank you all for tuning in. I'm the Wild Doc, and I do apologize. We'll do probably later this week because it's another research study. Maybe I'll do more of them, or we'll wait till next Tuesday, 6 p.m. to discuss this one right here. Again, medical marijuana use in oncology. Definitely highly recommend that. And I'm sure we're done with the radio show. Anthony will be done there, and I'm going to wrap it up about an hour. But I will note this, just a kind of a teaser there for all our Facebook Live folks. I've got to get home to my wife. That's the reality. She's probably watching this right now and saying, he told me he'd be home at 7:15, 7:30, and she's probably like, I'm going to whoop his tail if he doesn't get home right now. She's like, I'm going to take that hat off and smack him with it. She did give me the hat for Christmas. It's a pretty cool hat. I like the hat. It really fits the Wild Doc. I don't know. Makes me look like the next Indiana Jones. I'm going to go deep into the caves and look for the ancient relics that show us where health and nutrition come from, and the hieroglyphics that show us how to correct the spine all the way back in 400 BC, like Hippocrates said. Here's your teaser for medical marijuana use in oncology. Get on I have a couple down in the Facebook live feeds. I have a short video on medical marijuana use and use during pregnancy. Increases use of marijuana during pregnancy in America by 1% from just shy of 3% to just shy of 4%, and how the medical world is scared of that. But yet we have babies at epidemic proportions, especially in the state of Tennessee, being born addicted to narcotics. And I'm going to hammer this for the next couple weeks again. We've got to find alternatives, and I believe that the use of CBD, hemp oil, or medical marijuana will be something that can effectively lower the need for dangerous medications like narcotics and other things. But look at this. What's so crazy to me, I want Indiana Jones to figure out, how did they know this all the way back? How did they know this? Listen to this. The history and legal status of cannabis. Cannabis has a history of both medicinal and recreational use dating back centuries. Tradition holds that Chinese emperors touted the benefits of cannabis in the 28th century BC. Cannabis was believed to have healing powers for ailments including rheumatism, gout, malaria, even absent-mindedness. And then nowadays we think to ourselves, wait, cannabis actually causes people to have absent-mindedness. Well, maybe the cannabis they smoked or they used, rather than maybe they didn't smoke it, and that's what I'm advocating. I'm not advocating for smoking it, because you burn your potatoes, it increases carcinogenic chemicals in your potatoes. Don't burn your potatoes, although they're so good when they're crunchy. I like crunchy potatoes better than like, here we go again, getting off path. When's dinner? Cannabis was believed, I just think that's funny. Okay, in 1611, all the way back in 1611, the Jamestown settlers, all the way back to Jamestown, the settlers of the United States, listen to this, folks. Settlers brought marijuana, commonly known as hemp, to North America, and throughout the colonial period, hemp fiber was an import and an export. Cannabis was first introduced to the Western medicine by Surgeon W.B. O'Shaughnessy. I need to know how to pronounce things. Like, English was my, I did good in math and science. I didn't do good in English. But in 1840s, while working for us, it was introduced in the 1840s in the Western medicine, but the quote-unquote Eastern medicine, it was back in 28th century BC. While working for British East India Company, he reportedly found it to have good analgesic effects, anti-inflammatory, anti-spasm, anti-convulsant, so epileptic problems. During this time, a French psychiatrist conducted studies that found that marijuana use suppressed headaches, increased appetite, aided sleep. Marijuana was introduced into the U.S. pharmacopoeia in 1850 and was prescribed for conditions such as labor, pain, nausea, and rheumatism. Research now in the 2000s is literally proving that the Chinese emperor was right. That these people, the Jamestown settlers and these surgeons way back when, in the 1800s, were correct about the beneficial effects of cannabis. And again, there's a difference between THC and CBD. I'm really not at a place yet where I'm advocating for THC. I don't think I would advocate for changing our mindset necessarily. I'm not going to sit here and I don't know enough about it yet. But the reality is I see in this CBD, the cannabidiol, by far, huge potential. I mean, in this study, people with cancer pain that narcotics wouldn't even help. They didn't get relief from narcotics, and CBD worked. Hemp oil, cannabis oil, worked. They found people with severe nausea and vomiting and appetite suppression from their chemotherapy, it was up to 90% preferred to use cannabis in research studies than use the medical drugs they were prescribing, and that people would get their insurance to pay for. Just had a military member today coming in with his wife, and they were getting evaluated after a car accident, and they're good friends of mine, and he was telling me about how now they're utilizing CBD and cannabis and medical marijuana. They're doing research studies and giving that to people with PTSD. I mean, I just have to applaud those medical physicians, those advocates for this, because, again, look at this stuff, people. I mean, U.S. patent, United States, as represented by the Department of Health and Human Services, application filed April 21st, 1999. Cannabinoids have been found to have antioxidant properties unrelated to NMDA receptor antagonism. This newfound property makes cannabinoids useful in treatment in of a wide variety of oxidation-associated events, so there'll be loss of blood flow, low oxygen level, age-related problems, inflammatory and autoimmune diseases. The cannabinoids are found to have particular application as neuroprotectants, for example, in limiting neurological damage of following ischemic insults such as stroke and trauma, or in the treatment of neurodegenerative diseases such as Alzheimer's disease, Parkinson's disease, and HIV dementia. Look at that, folks. Man, our government has a patent on it, yet our DEA, who does DEA work for? They're the Drug Enforcement Agency, folks. They're enforcing drugs on the American people. They're working for the pharmaceutical industry. It seems every single government agency right now, whether it be the FDA, the CDC, or the DEA now, is working for the pharmaceutical industry. They're all bought off. And if you're a senator, if you're a representative, you're a legislator, or you're somebody who works for those organizations, well, if you're seeing the DEA schedule marijuana as a Class 1 drug, a Schedule 1 drug, yet the American government has a patent on the medicinal properties and proven medicinal potential of cannabis, and yet they say that cannabis is a Schedule 1 drug, who are they working for? How can you let that happen? You do the change. You make the change that I'm advocating for. If you don't push for that change, then in my opinion, either you've been sold a bill of lies about the harms of cannabis, about the dangers, the so-called dangers of pharmaceutical. And the biggest promoters and the funders behind research that is trying to say that cannabis is harmful, guess who they are? They're the drug companies, and then the narcotic industry is the biggest money behind research trying to say that the cannabis is harmful, or lobbying to our government representatives and legislators to try and make sure that medical marijuana is not passed. Thank God they haven't succeeded across this nation in every single state. I pray to God they don't succeed in Tennessee, right here. Guys, I'm not about abusing it for alteration of mind, but there are serious benefits. There are people out there suffering. We need to get this information out to them, and that's why I do this show right here. So, Anthony, any Facebook Live questions I should try and answer really quick before we sign off for the evening? Again, thank you everyone so much for tuning in. We good? Got something.
Yeah, real quick, Holly wanted to know.
Holly?
Yeah, what type of doctor degree should someone in another state look for that will match what you offer or do in your office?
You know, I utilize a lot of information and things that, functional medicine doctors would do in terms of utilizing the arena of nutrition, blood work, and looking at nutritional deficiencies, looking at detoxification protocols. You know, you can utilize those. You could actually schedule an online consult with myself through the Wild Doc website if you wanted to talk to me personally about health problems that you're having out there. And it was Holly, so I know she's already a patient, but she's probably asking about friends and family in other states. But, find a structural corrective chiropractor, a subluxation-based chiropractor. Usually those two terms go well. You know, upper cervical chiropractors are great for being typically neurologically based. If they talk in terms of adaptability, those things, if they do heart rate variability studies and testing, those are other things that typically you're going to see a neurologically based chiropractor do those things. So, we're all human beings. There's good and bad in every profession. So you may have to search around a little bit. Don't give up after you've visited one chiropractor. Don't give up after you visit one functional medicine doctor. That's why I utilize friends and family around me that are well educated in these topics. And that's also why I plan on going through more training, consistently reading and looking at the research in this, because, the calling on my heart and spirit, thing that I believe God's brought me here to earth to do is, number one, call out the lies and speak the truth about health and well-being. Teach people how to unleash the natural capability of healing, and get them well. So, all right, everybody, I'm going to wrap it up. You good? Thank you, everybody. Share it. Don't just like it. Share the truth. It's the only way we save lives.